Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
No. What is the diagnosis? So, gastroesophageal reflux disease, we should see the diagnosis of the gastroesophageal reflux disease. In the diagnosis, we can do endoscopy, and by doing an endoscopy, you can exclude the other diseases. Especially, tumors can be excluded with the help of the endoscopy. And if there is any peptic esophageal ulcers, these can also or injury can also be seen with the help of endoscopy. So thus the endoscopy is very important for gastroesophageal reflux disease. If we wanted to do surgery, it is very essential, or it is done if surgery is planned, or if we consider, or if the patient is considered for operative intervention, then definitely we can do this uh, endoscopy. But actually it is preferred in patients with gastroesophageal reflux disease. Manometry is very important because manometry is tells us about the function of esophageal body and also about the lower esophageal sphincter pressure. Manometry tells us. So manometry is also important. But what is gold standard is 24-hour esophageal pH monitoring. This is actually gold standard for diagnosing, and it is also helpful for quantifying the acid reflux which is occurring. So thus it is the 24-hour pH test is gold standard for diagnosing and quantifying the acid reflux. With the help of this 24-hour pH monitoring, we can assess the total number of reflex episodes, longest episode of the reflex, number of episodes which are lasting for more than 5 minutes, or extent of episodes which are present in upright or supine position. All these can be understood by 24-hour pH monitoring. So it helps us to assess the number of reflex episodes, longest episode of the reflex, number of episodes lasting for more than 5 minutes, and also the extent of episode in the upright or supine position. Now by doing the 24-hour pH monitoring, we can calculate a score which is called as D-Meesters score, which is very important. This D-Meesters score is the score which is obtained by using a formula, and this formula will tells us about the each item is weighed according to its capacity to cause the esophageal injury. Based on its capacity to cause the esophageal injury, it is weighed, and we use a formula, and with that formula, if you uh, in the formula each item is given its importance based on the esophageal injury it causes. So based on the D-Meester score, we get a score, and if this score is less than 14.7, then it is normal. It should be less than 14.7. Then we can also do an esophagogram, can also be done in these patients. Actually, this esophagogram will help us to evaluate the symptoms of the GERD when surgery is contemplated. And with the help of esophagogram, we can also find out whether there is hiatus hernia is present, and the size of the hiatus hernia can be found out with the help of the esophagogram. So 24-hour pH monitoring is the gold standard for gastroesophageal reflux disease.
thank you and thank you for watching.